7 a.m. Good morning. Today's day one. We are just leaving the Simba house and we're going to be walking towards the hospital and getting everything set up so we can start seeing patients. Day one.
This is the women's health center here.
Okay.
They do a lot of work with preventative health as far as HPV, making sure women are screened, vaccinated. They also do a lot of work where they go into communities and actually educate the men because there's a lot of resistance on the side of the male partners toward the female or women being screened and vaccinated.
That's crazy.
So they actually go out and talk with them. So there's actually been a very large shift over the last several years in terms of how the males view the women.
Oh, that's really good. We're going shopping. Main Street. Hey guys, okay, so today is day one. So we took you guys from the walk from our place in Simba House to a view of like the Mwandi Medical Mission Hospital. Then we're actually going to be setting up our clinic at OVC, which is Orphans and Vulnerable Children. And there they have the school and they have a lot of different facilities that are available to take care of orphans and vulnerable children. So they already have set up there 3 exam rooms, as you guys saw. So it's going to be a pretty cool, like we did the inventory this morning so that we can set up the pharmacy as well as like have areas where you can have the band-aids, gauze, whatever we may need in case there's any injuries or some unusual rashes. There's a very threshold of getting HIV testing done. So if there's anything suspicious, then, or anything that's even the slightest bit concerning, we send them to get tested for HIV. Every single child is going to get albendazole, dose dependent on their age and size, and so we set those up and we split those pills and took them so that we can just be really efficient with handing them out at check-in. It's just very, very common, so it just makes more sense to just give it to everybody because they will very likely need it at some point. And we have a whole bunch of other medications. I can't think of all of them off the top of my head right now, but just like very, I guess, the standard stuff typically that you would use. So yeah, we just broke for lunch and we're actually gonna start seeing patients today on day one. We're walking to day one of our half day of clinic. Dr. Syed with my
over there.
Am I in your way?
No, you're good. And now we're heading back. All right, so we just finished day one. It was more like a half day since in the morning we just like were setting up. We just finished the so we had I guess clinic from 2 to around 5. I think I saw something really interesting today. I saw a reducible umbilical hernia, and then we referred them to a specialist at the hospital, and also just saw a lot of people with tinea all over essentially, and I think it was pretty good. We saw a lot of kids, well, they're literally all kids except maybe one adult, but yeah, it was good. Tomorrow it's gonna be a full day. We're supposed to start at 8 and then we break for lunch, and then we should be done by 5, and I can't wait to take you guys with me. So tomorrow we'll do a whole day in the life type of thing so you can see what it's like. Now that we're done, we kind of just have the rest of the evening to just relax and have dinner and just chill. So looking forward to doing that. There's not really much to do in Mwandi, obviously, as you guys saw, but it's gonna be nice to just unwind and read a book, maybe do some questions or flashcards, but aside from that, just probably just hang out. And all right, so I'll see you guys later. Bye. Got little balloons for our patients. We can give them at the end, as well as pencils and stickers. They loved the stickers yesterday, so I think that's going to be a huge hit. So we have a soccer ball pump, so we can blow the balloons and not be winded. But yeah, it'll be fun. Let's get started. Okay. And then this is where we get the heights. What else do we do? And the weight. And then what's that?
We did the Albany sauce.
Yay! And then we move on to the dental station. Say hi, dental station. And then they go to one of the rooms here. And then pharmacy. Can you show us your clinic?
This exam room. Here, we have the bed, stethoscope hanging there. It's not as private, so if we need a private area, we'll probably stick to the room there. And then we've got our otoscope, gloves, wipes, sanitizer, and a headlamp for extra skin.
That's awesome. Oh, thank y'all. So I'm gonna make a whole video on this, essentials that people need when they're traveling to medical missions, even especially in hot areas. But this is something that I bought a really long time ago because I thought it was cute, and it's been years. But I never really used it, and I'm so glad I found it and brought it with me because it is so important. So this is how big it is. It is super small, very compact, so you can fit it into your fanny pack. Really, really simple. And basically, it's a light, first of all. So if you have to look at rashes and stuff, you can see the skin really, really well, even if there's it's dimly lit, and that often is the case because it's so hot. So try to keep things as cool as possible. The buildings are concrete, so sometimes you can't really see the nuances as well as perhaps that you would like. It's also pretty cool because there's a two different ways so that you can charge this. So I charge it overnight, and the overnight charge like has lasted me all day, and I use it a lot throughout the day. I'm not quite sure how long the battery lasts itself, and I really don't feel like testing it out because it is my lifeline right now. But you could open it up like this. It's really cute. Okay, and then you have one speed and then the second speed. It's like sometimes you are just blowing hot air, but like having that breeze when it's like 100 to like 104 degrees Fahrenheit outside makes a big freaking difference. So I'll be making a full video on like things that you have to take with you if you go on a mission trip, especially to a hot region. All right, walking back from morning clinic on day 2. It is so freaking hot. It's almost around 1 o'clock in the afternoon. Walking back to Simba house, and then we're gonna have lunch and then go back for afternoon clinic. All right. What did we just see? Or what did you just see? Because I didn't see it.
No, 12-year-old. I think she was 12. Yeah, 12. 12-year-old right lower quadrant pain, exquisite tenderness on exam and on the ride to the hospital. When we hit bump, she was really tender. She's saying she was having that pain for the past couple of weeks, which would put ovarian cyst rupture there, but it was exquisite tenderness in the right lower quadrant. You want to make sure that you rule out appendicitis. So she's at the hospital now. They're doing a CBC. They're going to do a bedside ultrasound. There's no CT.
Yeah, because she's 21, right? Yeah, she needs CT.
Doctor is saying conservative management right now. So,
and that's because of like the resource.
Probably, most likely because of resources.
That they wouldn't be able to do it laparoscopically,
Well,
most likely, potentially.
I don't know, it'd probably be a potential open case. I don't know if they have the laparoscopic equipment here, but we will see. We'll follow up.
We're headed to the hospital because one of the patients that we saw has a suspected appendicitis. So that's what Dr. Jones was talking about. So let's go. At another school today. We're here outdoors all day long, and we got to set up, so I'll be taking you along. Waiting to get in. This is our setup for today. How are you? How's she doing? No problem?
How are you doing there? Good?
Today is the last day of clinic, and we're going to be seeing the Suka primary school in the Suka region. So yeah, I'll try to take you guys along as much as I can. Just a little tired, given that it's the last day. I'm just going to be focusing on the patients primarily. 12:30 and we still got a lot of patients left. As you guys saw in the video, kind of getting a little tired. Yeah, just did a little check-in. It's the last day, so just gonna power through, and I don't know if we're gonna stop for lunch, but we'll see.